Have a look at this clinical question. I've launched the poll. So while you're selecting your answer, just a recap of the scenario. So this 55-year-old patient, they've presented with a painful red rash that's blistering. You can see it's on the forearm and the back of their hands. And it started while they were on holiday in Spain. They've got a history of rheumatoid and psoriasis, and they're on regular medication. And you can see that they've not changed their skincare products. They're taking their prescribed medications, as they should be, fully compliant. So what's the most likely cause? You can see there's a range of medications there. Slightly more challenging question, this one. So there's a much bigger spread of answers. All of the options have been picked. Roughly sort of fifth, just under a fifth, just under 10%, and about 40% picked methotrexate, which is the right answer. So although that was the most popular, more people got this one wrong than right. Okay, bigger spread compared to the last one. And again, there's been an MHRA alert specifically about methotrexate-associated photosensitivity reaction. So it can cause phototoxicity, it can cause very severe sunburn, rashes, which can be blistering or papular, it can cause swelling, and very rarely it can lead to such a bad reaction that then it leads to a secondary infection. And there's been 1 or 2 cases where it's actually ended in death of the patient. So one of the things is to advise patients when they're on methotrexate. Now, normally methotrexate will be started by the rheumatologist, right? But often under a shared care agreement, we'll follow them up to do some of the blood monitoring, for example. Okay, and so if you see them and you notice something, or they might mention a rash, just knowing that if someone's on methotrexate and they present with a rash or just mentioning a skin condition, it's just worth taking that bit of history and just reminding them of this, that they should try to reduce sun exposure where possible. If they are going to go out in the sun, they should use high sun protection, so high SPF sunblock. And then the other known issues, can affect the liver. You can get methotrexate-associated liver dyscrasias, which is one of the reasons why, we monitor renal function, because it can affect the kidney. We monitor FBC because it can cause problems with that, but also LFTs. And that's one of the more common things that we pick up in monitoring, is that with methotrexate, the liver function can go off. If they under advice of the rheumatologist, they'll be told to come off the methotrexate for a little bit. Sometimes if their symptoms of their primary disorder, why they're having the methotrexate in the first place, like the rheumatoid is flared up, they'll have something like steroids to deal with those symptoms for a bit, just so that their liver's rested. Stay off the methotrexate for a bit, and then we'll restart it, and then we'll start monitoring their bloods again. Okay. Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.